doctor today. I am Dr. CalmingEscape. Can you tell me what happened, sweetie? You fell off the swings. Ouch. Right. Did you see it happen? Okay. Did they lose consciousness at any points? Okay. Anything that we should make note of? Okay, well, I'm gonna kind of do a little checkup for you, make sure that everything is okay. Okay. Before we start though, I need you to tell me if anything hurts. Yeah, do you feel any ouchies anywhere on your body, on your head, your arms, your legs, your back, even your toes? Does anything hurt right now? Okay. Alright. Well, we're just gonna do some checks to make sure that you didn't bump your head too hard when you fell off the swings. Were you going pretty high? Yeah. Lots of fun though, right? Usually is. Okay, so let's see. When you fell off the swing, did you notice if your head hit anything? Okay. How's their speech been? Forming sentences okay? Good. Good, good. Yeah. Sounds like you're a very good speaker. What grade are you in? Good. You seem like a very smart kid for only that grade. Okay, now a couple questions for you, just to make sure you remember a couple things. What's your name, sweetie? Yeah. Okay. What's your favorite color? It's a good pick. What's your favorite cartoon? Yeah? I like that one too. Who's your favorite character on there? Good. And what about some numbers? You look pretty big. You probably know how to count to 10, don't you? Okay. Can you count to 10 for me? Okay. 10. Good job. Okay. So we're just going to run a few tests for you, but they're going to be super easy, maybe a little silly and fun too. Okay. If you have any questions for me, you go ahead and ask. Good. Now, you mentioned your elbow and your head. Okay. Can I see your elbow? And your head? Is it on this side? Okay. I'm gonna pop on these bright blue gloves for you. About how long ago did the fall happen? Okay, good. No, it's good that you brought them right in. Better safe than sorry, yeah. Okay, so as soon as I put my gloves on, I'm gonna get a little closer to you, and I'm gonna press my fingers against your head. Can you tell me if anything hurts? So, here we go. I'm just gonna gently touch your head. Does that hurt? Okay. I do feel a little bump, little egg forming on your head, probably from where you fell. I don't see any sort of wound or anything. Good. Oh, goodness. Quite the fall. Don't worry. I think all of us wished we could fly when we were kids. Would be quite the superpower, wouldn't it? Okay. Next up, I'm going to look at your eyes. I'm going to take a little flashlight and kind of look into your eyes. You're just going to stare at my face, probably my nose. Okay. This is my little flashlight. It's just a little one, and it has a little light. So, let's look right at my nose. Okay? Good. I know it's going to be a little bright. Good. Good. Okay. Now, if you can you look at the light? Look at the flashlight? And follow it with your eyes. You want to see me do it? Look. I'm gonna shine it on my face. And as I move the light, my eyes follow it. That makes sense? Okay, sweetie. So just look at the light and follow it. Follow it. Good. Follow it. Follow it. Good job. Now, you did your numbers pretty good. Do you know your ABCs too? You do. Okay. I'm going to grab a little chart for you. And I'm going to point to some lines and have you tell me which letter that is. Do you think you can do that? Good. I figured as much. You're pretty smart. Okay, let me grab that chart. They ever had any sort of vision troubles? Okay. Do they wear glasses? And do you roughly know the last time they had an eye exam? Okay, good. Good. Let me grab that chart, sweetie. Alright. So, here we have this little chart. Now, can you tell me what this big letter is at the top? Good. What about this line right here? What are these 1, 2, 3 letters? Good. Now, if you look, what's the lowest line? What's the tiniest letter that you can see? Good. Okay. And if I cover up this eye, can you read the second line? Good job. And if I cover up this eye, can you read this third line? Good. Good. You're a good reader. Okay. Now I'm going to use my gloves again, and we're just going to feel your face and your neck. If anything hurts, you gotta let me know, okay? Good. Okay. Just light little touches. Might tickle a little bit. Okay. Is that a little sore right there? A little bit. Okay. Okay. Doing so good. Yep. You're being really brave, just like a superhero. That's okay that you can't fly. Bravery is a very important part of being a superhero. Good. Now, I'm going to ask you to do some silly things with your face. Okay? First, can you smile? Great big, great big. Good. Can you frown? Good. Puff your cheeks out. Good. Can you do a fishy face? Good. Can you stick your tongue out? Move it to the side. Move it to the side. Good. Now, I'm going to have you close your eyes, and I'm going to try and open them, but I want you to squeeze your eyes shut. Okay. Close your eyes. Keep them closed, keep them closed, keep them closed. Good. Okay. Good. Now, if I put my hand on your jaw, right here, can you try to turn your head against it? Good. Same on this side. Put my hand on your jaw and turn your head. Good. Good. Okay. All right. So, next up, our lovely nurse is going to take you next door. We're going to get what's called a CT scan. Yeah, it's just a fancy doctor word. We're basically going to put you in a big donut. You're going to lay down and you're going to get rolled into the big donut. They're going to take some pictures of your head. And to be extra careful, we're going to get some x-rays of your arm where that scrape is. We're just basically going to take some pictures of your bones. Make sure that everything is okay in there. Is that all right? Okay, so you're going to be right next door. There is a little bit of paperwork you need to fill out. You can go with them if you like, but it is the room right next door to us. Okay, perfect. So you're going to go with the nurse to the CT and the x-ray. Good. Just like I said, you're being super brave. You're being an awesome superhero. Okay? Good. Okay, now that I've got you for a second, don't worry, they'll be just fine. You can kind of hear them talking in there. Good. Yeah, really brave kid. Okay, so I just have a couple questions for you. Medical history and whatnot. So, any allergies? Yeah, your child has. Okay. And are they on any medications? Have they ever experienced a fall like this or been diagnosed with a concussion? Okay. Has your child experienced asthma? Ear infections? Cerebral palsy? Any bladder infections? Seizures? Any development delay? Any sort of learning disorders? they ever had a blood transfusion? Any need for that? Okay. Hearing problems? Have they had a hearing test before? Okay. At school, yeah, they usually do it in the younger grades. Okay. Right. And has there been any sort of hospitalizations or operations? Okay. Good. Okay. And is there any sort of past injuries that you would like me to make note of? Okay. So a twisted ankle last year, that's pretty normal for kids. Yeah. Okay. Good. But no falls or broken bones? No. Okay. Good. Okay. Now, just a little bit of family history for me. Any sort of heart disease in the family? Okay. High blood pressure? History of strokes? History of epilepsy or seizures? Okay. Diabetes? Allergies? History of any sort of breathing conditions like asthma? Any sort of birth defects? History of cancer? And any sort of mental illness? Okay. Good. Just wanted to make sure that this is all updated. I know that you see the regular physician for the general checkups. And do you know that doctor's name? Okay, good. Oh, we still have the accurate information. Good. 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 And let me look at my records here. Looks like they're all up to date on their shots. Wonderful. And past health reports, very healthy. Good. Okay, good. Got all the information up to date. Yeah, these things happen. There's no need to be hard on yourself. Kids are kids. Yeah, I'm sure that you probably told them to go a little slower on the swing there, but I'm sure you remember. The swings were fun. We could pretend we could fly, right? Okay. You guys all done? Okay. It's just going to be a little bit of time to get those results back from the CT and the X-ray. You guys feel free to relax in here for a bit, and I'll be back to check in with you when we have those results, okay? Okay. Well, welcome back. How did you like the big donut in the X-ray machine, huh? Good. All right. So it looks like there's no worries of broken bones or major injuries. Now, there may be a minor concussion, like very minor. They're not showing any of the worrying signs, and it was pretty much clear. So, it just might be a minor bump to your head. Yep, but your bones and your brain in there is just fine. I'm gonna go ahead and clean up and bandage up your arm here for that scrape that you had on your elbow. It's still hurting? A little bit better. Okay. So you'll just have to sit still for me. Another pair of blue gloves for you, dear. You are being a fantastic patient, so you need to think about which sort of treat you want. Good. here. First off, I'm gonna wipe off your elbow. Okay, might be a little sore. Okay. Now, I'm gonna put a little bit of medicine on it just to make sure that the scrape is clean. Okay, so it might sting a little bit. Okay, but I promise if we both count to 10, the stinging will go away. Okay, so let me just put a little on there. Hold still for me, I know. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Good. Okay, now I have a little bandage for you. We're just going to wrap it on your elbow. Okay. Good. Okay. We're also going to give you a little something for that sore head. Yeah, it's just some children's Tylenol. Just to make sure that not in any pain. Okay. If the pain gets worse or any other symptoms arise, please give us a call. Bring them back in. But as I said right now, there may be a minor concussion, but it doesn't need any sort of extra treatment. No. Might have that bump, that little egg on their head for a couple days, and if it's tender or if it's a headache, children's Tylenol would be just fine. And the scrape, it wasn't deep. It doesn't need stitches, not even butterfly stitches, so I just cleaned it up and put a bandage on. You should probably be able to take the bandage off tomorrow. Yeah, it really wasn't that bad, so, but don't worry, it's always more important that you bring them in just to make sure, of course. Okay, now, you little one, what type of treat do you think that you want? I have stickers and I have suckers. Well, let's show you. Okay, so my stickers are kind of limited here, but I do have these little ones. There's a spider web, a puppy, a turtle, a bumblebee, a zebra, a butterfly, a fish, a moon, a lion, and a star. Do you think you would want one of these little stickers? Okay, which one? Okay. Where do we want to put it? On your hand, okay? There you go. And because you are an extra brave superhero today, I do have these suckers as well. Which one do you think you want? This one is berry flavored. This is rainbow flavored. Which one do you think? Okay. Here you go. You enjoy that treat. Did you need the other one? You've had a stressful day. Here you go. Okay, guys. Will you try and rest up? No flying practice for a while, okay? Gotta be a little bit more careful. Okay. You guys have a great day. Bye now.